You're listening to an African Elements top news story for July 15, 2025. Please visit our website at africanelements.org for more daily news. The world is currently off track to meet the targets set by the Immunization Agenda 2030, IA 2030, a global strategy by the World Health Organization, WHO, and partners. IA 2030 aims to reduce illness and death from vaccine-preventable diseases, ensure fair access to vaccines, and strengthen immunization within primary healthcare. It sets goals of achieving 90% global immunization coverage for essential childhood vaccines and halving the number of unvaccinated children by 2030. However, data from the 2024 estimates of national immunization coverage, WNIC, reveals that 20 million children missed at least one dose of the diphtheria, tetanus, and pertussis (DTP) vaccine in 2024. The DTP vaccine protects against serious diseases, and the completion of 3 doses, DTP3, is a global marker of immunization program strength. Of the 20 million children who missed a DTP dose, 14.3 million received no vaccines at all, known as zero-dose children. This number exceeds the 2024 target by 4 million and is 1.4 million more than in 2019, the baseline year for IA 2030. In 2023, there were 14.5 million zero-dose children, indicating a worsening trend. These children are unprotected against common vaccine-preventable diseases, making them highly vulnerable to illness and death. Global childhood immunization levels stalled in 2023 and have not returned to 2019 levels due to challenges like healthcare disruptions, logistical hurdles, and vaccine hesitancy. The number of children who did not receive a single DTP dose increased from 13.9 million in 2022 to 14.5 million in 2023. Conflict and humanitarian crises are major barriers to vaccination efforts. Children in 26 countries affected by conflict or emergencies are 3 times more likely to be unvaccinated than those in stable countries. Half of all unvaccinated children globally live in these 26 countries, with numbers rising from 3.6 million in 2019 to 5.4 million in 2024. These crises disrupt health systems, displace populations, and divert resources from essential services. Despite these challenges, immunization coverage in 57 low-income countries supported by Gavi improved, reducing roughly 600,000 and under-vaccinated children. However, inadequate coverage and delayed supplementary immunization campaigns have created significant immunity gaps. In 2024, 20 million children missed their first measles vaccine dose, and 12 million did not complete their second dose, leaving 30 million at risk. This has led to a surge in measles cases, with 360,000 confirmed globally in 2024, the highest since 2019. The number of countries experiencing large measles outbreaks rose to 60, almost double the number in 2022. In 2023, only 83% of children received their first measles vaccine dose, and 74% received their second, insufficient to prevent outbreaks. Global outbreaks of vaccine-preventable diseases increased, with 109 large or disruptive outbreaks reported in 2023, a 43% increase since 2021. Immunization efforts face challenges beyond vaccine availability, including fewer health facilities, healthcare worker shortages, and difficulties reaching remote communities. In high-income countries, vaccine hesitancy fueled by misinformation has decreased acceptance. The COVID-19 pandemic disrupted routine immunization, creating a cohort of children who missed vaccinations. A persistent funding gap hinders progress, with only $9 billion raised of the $11.9 billion needed to achieve immunization goals. Despite challenges, there has been progress. The number of zero-dose children decreased slightly from 14.4 million in 2023 to 14.3 million in 2024. In 2024, 85% of infants received 3 doses of the DTP vaccine, an increase of 1 million from 2023. UNICEF's zero-dose immunization program has vaccinated over 1 million children in conflict-affected regions since 2023. Gavi allocated nearly 200 million routine vaccine doses to 35 lower-income countries to reach children who missed vaccinations during the pandemic. In 2024, 43 million girls were vaccinated against HPV, putting the world on track to reach 86 million adolescents by the end of 2025. This progress in HPV vaccination represents a successful expansion of vaccine programs to include cancer prevention. Continued commitment and investment in immunization programs are crucial. To meet IA 2030 targets, strategies include developing policies to reach children who missed vaccinations during the pandemic and strengthening immunization services. Investing in healthcare infrastructure and training more health workers is essential. Copyright African Elements.